The University of Michigan Health West has adopted a new system that uses artificial intelligence to document patient-doctor interaction. It's called Dragon Ambient Experience, or DAX, and it allows the doctor to focus on patient care rather than the computer. I caught up with Dr. Lance Owens to talk about how it works and why he calls it a game changer for medicine.
Okay, so this new technology actually listens to the conversation that's happening in the room, captures it, and then translates it automatically into notes. Is that right? Explain how that works.
Yeah, so it's amazing new technology, which is just fantastic. And we use a listening device. In our case, we're using either an iPhone or an iPod Touch. They also have this availability of a device that hangs on the wall. But the technology listens to the conversation in the exam room. There could be as many as 3 or 4 people, and it knows who's talking and what to do. That conversation is digitized, and then it's uploaded to an artificially intelligent natural language processor. And the technology takes everything that's supposed to be in a really good exam note, office note, and takes out everything that's not. And it produces a better note than I can do in a much more efficient way.
I mean, it also probably makes the patient feel more engaged, that you are more engaged because you're not taking notes or typing it into the computer.
Yeah, I think that is the best benefit, which of course has many ripple benefits. The fact that I can walk into an exam room again and look my patient in the eye and have a meaningful conversation, synthesize the information they're giving me, and come up with a plan and discuss that and educate with them without having to worry about all of that getting documented into this note is just fantastic. It takes off a lot of the cognitive burden that has been placed on providers with the whole EMR of having to get the information into the system. It allows the patient to feel more relaxed. I'm more relaxed. I think patients are feeling like the visit was more productive. And we can really, you know, like I always say, we're using our technology to wrap our arms around our patient to take care of them. And I think this is one of those things, they really feel it.
And you've been using this in the pilot program too. The response has gone well?
Yeah, so there have been 15 providers at Metro using it since about, the longest has been since April. And we've come to the point where we have just gotten so much overwhelming feedback, primarily from our primary care providers, but across the board with our patients. I mean, our patient satisfaction with regards to using this technology called DAX has just been fantastic. We ask our patients 5 questions when they leave the room when they use this technology. One of those questions, which I find very interesting, is compared to the last visit with this provider, did this visit feel like it was more patient-focused? And 4.9 out of 5 times, they tell us, yes, it feels like it's a more patient-centric visit. So it's just fantastic.
Yeah. The next phase then is rolling it out all across the board?
Yeah, so we will actually be the first institution in the country that is going to have a widespread rollout. We are in the midst of rolling it out to all of our primary care providers. So there are institutions using it spattering throughout their medical staff, but we'll be the first one that's going to take a whole service line and use this technology.
Well, it sounds just incredible. Dr. Owens, thanks so much for your time. Congratulations on this too.
Yeah, thanks for helping us get it out there, because we hope all providers and all patients get to experience this eventually.